we're going to be working in the broker community, it looks like very closely with what used to be the navigators. Now they're called the individual
in-person assistants. In-person assistants.
IPA. And after this, I'm going to need some IPA. But that's their role, and we fill a role with them is that they can only go so far, and the agent broker community or the individual, if they wish to do it on their own, takes it from there. And so we'll let Larry take over.
Thank you, Rod. So hello, everybody. Larry Thompson with the Whatcom Alliance, and I want to thank Employee Benefits Planning for, first of all, their leadership on hosting this event and for inviting WAHA into it. We're going to do a little bit of a change up here. You've had a lot of information. I'm going to try to step back a little bit and look at this from a little bit broader perspective, and then very quickly get down to a few details about how people can access insurance. So basically what I'll cover is the question of if we've got 25,000 individuals in Whatcom County, how can we get as many of them as possible signed up for some form of health insurance in the next couple of years? And some people will go in through the broker route, some people will go in off the internet, some people will go in through in-person assisters, and I'm going to try to explain some of that. Whoops, over here. So WAHA is been around for about 10 years or so. We basically do two things. The first thing, and what we're probably most known for, is connecting people either with health insurance or to donated medical or dental care. And we've been at that for a while. We typically serve about 9,000 individuals a year. People that come to us are disproportionately low income and uninsured, but we do get a fair number of business connections and people who are employed that come in, and I'll talk about future world with respect to that. The other half of what WAHA does is that our board of directors, which is representative of the whole community here, has taken the view that the healthcare system as we know it now is not functioning particularly well. Is there a way to better organize it, get the incentives a little bit more lined up at the local level? And that's a whole other thrust of our activity. So a little bit on the case for change very quickly. The reason we're here talking about all of this today is that our costs have been going up very quickly. You're probably used to 20% rate increases by now. And relative to the rest of the world, our costs are very high. And at the same time, from a quality standpoint, the US healthcare system doesn't perform particularly well. We're tied with, I think it's Croatia, for number 37 in the world. So in addition to those two problems, we have a problem with lack of access to care that is mainly driven by lack of insurance. So nationally, about 16% do not have health insurance. And then there's another whole bunch of people who are what you'd call underinsured, as we have higher deductibles and co-payments and premium and things of that. In addition, the patchwork of coverage we have can tend to be a bit confusing, so a need for navigators like brokers or in-person assisters. Health reform is not a new idea. This is my third rodeo with health reform, and I suspect we'll see several more rodeos with health reform over the next few years. This slide I throw in with the gentleman trying to put the toothpaste back in the tube to make the point that once the legislation passed way back in 2010, a whole lot of change started happening in the healthcare delivery system that just can't be reversed. We're seeing mergers, acquisitions, consolidations, changes in product lines from insurers, just massive change throughout healthcare. So in a broader sense, what needs to be reformed? These four factors are the kinds of things that could be functioning better in the way healthcare is organized. But the Affordable Care Act, Patient Protection Act, it really is primarily focused on access and reform in the insurance market. There are dimensions of it that touch on these other three issues. Today, we're focusing primarily on the access part. Now, what's our situation with respect to uninsured people? So top line is Whatcom County. We have right now about 25,000 uninsured people, and about 7,500 of those are going to qualify for Medicaid coverage that don't currently qualify for Medicaid coverage. And then there's another almost 12,000 people that are going to qualify for subsidies, either as individuals or through the SHOP process that was just explained to you. So fundamentally, the job that we're taking on is to try to find as many of those 25,000 people as we can and link them up with options for care. And how do we do that? A lot of this is a state and local partnership. Over the summer and into the fall, you'll see an awful lot of advertising. I believe there's something like $1 to $2 million in advertising that's about to roll out just in this state alone that will try to get people aware of this whole phenomenon. I heard the other day over half the people think the Affordable Care Act was repealed or not implemented or something of that sort. So there's more confusion than there is light at this point. Secondly, it's always been anticipated that a lot of people would sign up online, and I think those estimates of how many are going to do that are probably optimistic, but time will tell. It's going to be easier to use that online option. As was briefly mentioned in the prior session, there's a statewide call center that people can call into to get their questions answered generically about what am I eligible for. And there are in-person assisters, and that's where WAHA and a bunch of other community-based organizations fit into this puzzle. And I'm going to have a couple slides that explain that a little bit more. And you can also use your broker or agent to help you line up with health insurance. So this is a schematic of the general form of organization for the in-person assister pathway to find healthcare insurance. So you have the exchange out there that was discussed in the prior segment. In this, we're hopeful that, we don't yet know this for a fact, but we're hopeful that we'll have a 4-county consortium of about 20 nonprofit organizations that will be helping people to sign up for coverage. And WAHA, where I work, will be the lead agency for that. You'll see a relationship to brokers. And that is a bit of an oversimplification, what I'm going to say, but in general, it's going to work this way. We've always had some small businesses and individuals who are eligible and want private coverage outside the Medicaid program come to our office. We are not going to be, and we haven't been in the past, able to offer advice on selection of this plan versus that plan. What we do as WAHA and in-person assisters is to give you general information on how this whole thing works and to give you information about the system and what your options show, but we can't give you advice. We're specifically prohibited from saying this plan is better for you than that plan over there. When we encounter people who want that kind of advice, we'll be referring them to brokers. And we've been meeting with brokers throughout the 4-county area to set up a system to make those referrals. Likewise, on the other side of the equation, many people who are eligible for Medicaid don't typically go to the brokers. The brokers don't get reimbursed for helping the Medicaid individuals. So the brokers will be referring, if things work effectively, individuals who come in who may qualify for Medicaid to come over to WAHA or one of the other community-based organizations to help sign up for the coverage. So we have a whole network of organizations set up in Whatcom. We've got the the Opportunity Council, the 2 community health centers that we have, CMAR and Interfaith, St. Joe's Hospital through the emergency room primarily, and Planned Parenthood are all on board to work with WAHA to basically create a network of a number of locations for the purpose of finding and enrolling individuals in a cooperative fashion. So part of what we do is to locate people who are uninsured. We do that through looking at demographics and other kinds of data. We do that by helping people enroll online. For example, in Future World, you don't any longer go to the DSHS office to sign up for Medicaid. You do that through the same portal that the private insurance is using, and you sign up online. And there's a different kind of eligibility mechanism for Medicaid into the future that we could get into if you're interested in that. All of this has to work as a system of collaboration. Last thing we want is duplicative functions, so we're trying to make sure we communicate and coordinate with all the different moving pieces in this puzzle. So the last thing I'm going to touch on with just a couple of real quick slides is set aside for a minute this whole thing about access and insurance. In the community, I mentioned one of WAHA's missions is to look about, is there a better way to organize healthcare so that it gets better results and is less expensive? So we have organized and have had going for about a year and a half now a process that involves stakeholders in healthcare, to some extent in business, to look at, are there ways to better organize healthcare? We've had, this is just a sample of some of the organizations that have been involved in that. And the basic goal has been to improve the cost performance of healthcare, improve quality, and also improve the experience of care. Now, this is 2 minutes worth of information on this topic that there's about a whole hour's presentation on. But I wanted to leave you with the thought that on that broader issue of cost and quality, there is a community effort underway. We'd invite you to find out more about that and to join into that as well to the extent that you're interested. So thank you for your kind attention today, and anybody have any questions, I'm happy to try to address those. Okay. You'll need this, won't you?
Although we get lots of questions that relate to finances and taxes, we are usually always first to say, well, we're not a CPA firm, and we rely on them for their expertise. So Tony's going to come up and give the overview really on the assessments, qualifications, and math that's all part of this healthcare reform that's going to kick into gear. And we've been doing it now since 2010, as stated. So Tony, you're on.
All right. Once again, Rod and Larry and Ray, thanks for the opportunity to be up here and help clear up some information, or give some information and clear up some misinformation you may have. There has been a lot of information pushed out about this, some of it inaccurate, some just early in the process and vague. So what I hope to do here is clear up some of that, as well as provide some of the new guidance that has been released since some of the first press came out about this. What I'm primarily going to hit, because it is a big issue, is the penalty for employers who are mandated to offer coverage to their employees. And it's popularly referred to as the pay or play penalty. And I will trip over that every time it comes up. I've done this too many times, and I just can't quite get around that phrase. Before we get any farther, this is my disclaimer. Please, please, please do not take any information you hear from me or that you have in your handouts and act upon it. The provisions of this law have what I call very long legs. And as you get down into the details, what may seem like a mundane topic or a mundane dynamic to you could have very, very specific and very different, put you on a very different line than what you might think. So take this information and use it for discussion points. Make sure you're asking all the right questions. and that's what I hope it will do, is make you ask questions that you may not have asked otherwise. Consult with your tax professional, make sure that your specific details and the dynamics of your specific company are dealt with before you make any action based on what we're going to talk about here. Just very quickly, and this has already been hit on, what's driving a lot of this is that all of us as U.S. citizens have an obligation to have health insurance as of January 1st, 2014. Without that piece, a lot of this healthcare, a lot of the employer mandate piece would be of less value. And as most of us probably know, last June, the Supreme Court ruled that this legislation is valid. So the requirement for each one of us is to have minimum essential coverage. That's as much as I'm going to use that term in my presentation. There's a penalty per taxpayer, and you see it increases to the maximum in 2016. An interesting dynamic on that, as an individual, if I'm obligated to have insurance and I choose not to, I expect, and this has not been specifically articulated, but I expect that there will be a checkbox on your tax return, and you will say, yes, I have coverage, or no, I don't have coverage. And your fine, if you check the no box, will be on that tax return. If that's the only piece that you have outstanding of taxes, you don't have a refund that the IRS can collect otherwise, they can't use any other collection mechanism to come after you. It's just, that applies to the individual mandate. Employers enjoy no such exclusion. So I have heard employers can get that piece confused, that, well, the IRS can't come after me if I don't pay. That's not true. So as an employer, what do you need to be asking? What do you need to be talking to your professionals, both your insurance professionals and your tax professionals? First and foremost, the requirements all revolve around how many employees do you have, and is someone who works for you an employee? And so I'm sure if you're an employer, you've dealt with whether somebody's an independent contractor or if that person is an employee. That decision, which side of the line you fall on that, will take on, in my opinion, much greater significance with this law. And I don't think I'm reaching too far when I say, if in 2016 you undergo an employment audit and they determined that there were 20 individuals that worked for you that were counted as contractors and they should have been employees. You're also a large employer, so you had an obligation if they were an employee to offer coverage if they worked full time. That's fine. If that happened in 2011, you'd have back payroll taxes, you'd have back payroll filings to file, and you'd have a monetary amount you'd have to pay. If in 2016 that occurs, and one of those individuals that was classified improperly had a major medical event in 2015, what is your exposure as an employer in that situation? I haven't heard a lot of people talk about that, but I don't think I'm reaching too far to say that I think as an employer you have a lot of liability. You can take that and run with it. But that is one dynamic where, just as an employer, make sure that you have clearly defined, both for state and federal purposes, whether somebody is an employee or not an employee. And once you've determined that, once you've made the calculation of whether you're a large employer and are you a large employer, and do you have an obligation to offer coverage to your employees? And as we go through this, and you may find that you have a lot of employees, but you don't necessarily have a requirement to offer health coverage under the new law, but you do already. Think about why you already offer health insurance, or why you don't currently offer health insurance. I've talked to a lot of people who say, well, when the exchanges come online, what's to keep me from just dropping my coverage and letting my employees go out to the exchange? Well, nothing. But if you have coverage right now, why are you offering it right now? There has to be there's probably a non-tax reason. You don't have a requirement to do it now. Why are you doing it? All of those reasons don't change because the legislation changed. So make sure that you keep that in mind as you go through your decision-making process. So again, to the question, will you have to provide health insurance to your employees? The first bar to hit is, do you have 50 full-time equivalent workers in your company, in your organization? If you don't hit that bar, you have no penalty exposure. You stay out. I like to describe it. You have a big house. If you don't meet that bar, you don't walk in the front door. There's no other rooms to worry about. You stay outside the game, so to speak. If you do have 50 full-time equivalent workers, then you walk in the first door. The next question to ask is, do you have 30 full-time employees? And it's important to keep full-time equivalents and full-time employees different because they are two separate pieces, and they come with different dynamics on each piece. And secondly, if you do offer coverage, if you are required to offer coverage and you do offer coverage, is that coverage affordable? And we'll talk a little bit about what affordable means. This graphic you have in your materials here, that what we just went through, is basically that first big box. So we're going to, if you've looked at those dynamics there, and we've answered yes, we're going to move on to the next box down that side of the decision tree. A little more detail on what full-time workers means. There are basically three groups of workers you're going to evaluate within your workforce. One, if somebody works on average 30 hours a week or greater than 30 hours a week, they're a full-time employee. So you put them in one category. You look at the rest of your workforce, and you're going to evaluate full-time equivalents for your non-full-time employees or your part-time workers. You're going to aggregate all of their hours and divide by, you're going to take them all for a month and divide by 120. And that comes up with a full-time equivalent for a monthly basis. Add those two numbers together, that's your full-time equivalent workers. That's the number that needs to meet 50. Again, if that doesn't meet 50, you have no, on the decision tree, you have no penalty exposure. The other piece, if you have a seasonal business, then you may be able to exclude some of your seasonal workers. The law references the Department of Labor's definition of seasonal worker. My take is, and I'm being probably a little more conservative than other professionals may take it, but I've talked to some contractors, other people who have seasonality to their business. And I'm not carving that off as a seasonal business. A very clear-cut seasonal business is agriculture. You have a harvest season. That's not just your peak time. You don't have seasonality to your business. Like if I'm talking to a construction contractor and they have more workers during the summer because the weather's nicer, they have more business. That's seasonality, not necessarily a seasonal business. They're open all year round. They're doing the same thing all year round. When you're harvesting, you only harvest during the harvest season. It's not a seasonality, but a seasonal business. And then those workers you hire for that season, do they work less than 120 days? If they do, you can exclude them from this full-time equivalent calculation. And lastly, if you have a large company, and I've heard several people come to me to say this, we have a large company, but it kind of operates with divisions. What if we just split up those companies into different, separate, distinct corporations? Does that offer us any relief? And the answer is no. As long as one person owns 80% or a small group of people own 80% of all of those, common ownership or what they call a controlled group, they're all going to be grouped together into one pot, so to speak, when evaluating all of your full-time equivalent workers, your full-time workers, everything under this law, you're going to treat them as one. And that actually mirrors some long-standing regulations with 401k plans and that. So that piece, evaluating that, is not necessarily new. Most everything else in this law, we're looking at it on first blush. So if you have a mix of full-time and part-time, which most people do, what does my workforce look like when I'm using a 30-hour-a-week base as a full-time worker instead of a 40-hour-a-week base? So that's most of what we're familiar with. So here's just some examples. Obviously, these can be as mixed up as you want to do the math to do. But I just want to put that in there to give you an idea. If you have 10 full-time employees that work 40 hours a week and 60 part-time employees that work an average of 20 hours a week, that's going to be right at the 50 full-time equivalent worker mark. So we come back to our decision tree here. And the next piece down is your full-time, just make sure I read this properly, are any of your full-time employees receiving a benefit at the exchange? And Scott talked a little bit about what that benefit is at the exchange. I'll hit on it here a little bit with a little different perspective. If you're obligated to offer coverage, so you have 50 full-time equivalent workers, and you have and your full-time employee goes out to the exchange, so you're obligated to offer them coverage, They go out to the exchange and they want to get coverage there. They're only going to receive a benefit from the government, a subsidy, if they have unaffordable coverage, if you're not offering them affordable coverage. Affordable coverage, you as the employer can deem yourself offering affordable coverage if the employee does not have to pay more than 9.5% of their income. And that's where the safe harbors come into account. If I'm an employee that works for a company that's not obligated to give me coverage, and I go to the exchange, they will look at my household income. My household income encompasses my income, my wife's income, and the income of any children that are on my tax return. My employer, when they go to evaluate whether they're going to have any penalty exposure for offering unaffordable coverage or not, they're not going to know what my wife works, and honestly, I don't want to necessarily share that information with them. And as an employer, I don't know that I actually want to know that information from my employees. It's none of my business. So what can I do as an employer to make sure that I can do everything I can to make sure, one, I avoid the penalty, but two, that I'm offering coverage that it's deemed proper under the law. And that's why, if you have a salaried employee, this makes it really easy. If you're paying somebody $40,000 a year, you can take 9.5% of that, and as long as their obligation to be on your policy is less than 9.5% of that, and as Rod mentioned, that's about $3,600 a year, $300 a month. As long as their monthly obligation is less than $300, you're offering affordable coverage, and you don't have any penalty exposure under that piece of the penalty. There are also other two pieces, but in the effort of time, I'm going to go on, and I can answer any questions on that later if you fall into that. So again, if that employee goes out to the exchange, what's their eligibility to get a credit out at the health insurance exchange? One, either their employer does not offer coverage at all, or they offer coverage and it's not affordable, doesn't meet that 9.5%, and the employee has certified to their employer that they've gone out and done this. That they, as me as an employee, I've gone out to the exchange, I've gone through all the math, they've worked out the things, okay, I get a credit of X amount. Now I have to take that information back to my employer, and I have to say, Mr. Bossman, this is what I've done because you haven't offered proper coverage for me. I get this, and you have possible penalty exposure for that. So that's the next. I don't have a laser on this. So that's our second decision bubble down the left-hand side. The second one there is, when is an employee considered full-time? If you have a mixed workforce and you have somebody that works 1 week 25 hours a week, the next week 35 hours a week, the next week 28, the next week 32, does that person work over 30 hours, or do they work under 30 hours, which is the full-time mark, the decision line there? If they work consistently greater than 30 hours a week, they're a full-time employee. It's very easy. If you're a large employer, you have an obligation to cover them. If they're a variable hour employee, then and they meet what I just described, then you have some extra work to do to draw a line and find out which side of the line that they fall upon. The initial determination is based upon what their expected employment is. So if you hire somebody and you know that they're going to be working more than 30 hours a week, you have an administrative period to get them in the plan. If you don't know and the nature of their job is variable, then you have to go do a little extra work to see where they fall. If their duties change, that individual may no longer be a variable hour employee and may need to be enrolled in the plan within your administrative period as soon as those duties do change. An easy example, let's say I have a restaurant and I hire a waitress and she works some weeks 20 hours, some weeks 35 hours a week. She's a variable hour employee. It's a very easy example. She does a great job for me. I promote her up to assistant manager. Assistant managers consistently work 32 hours a week. She's now a full-time employee. She's no longer a variable hour employee. I have my administrative period, whatever's been set, to get her into my plan if I have an obligation to provide coverage. And that's where measurement and stability periods come in. It takes about 20 minutes to go through just this, so I'm not going to get into this very deep. But what a measurement and stability period does is you take those variable hour employees and you split them into two groups. One, sorry, let me back up. For purposes of the law coming into effect in 2014, if you have variable hour employees, you should be evaluating them now. Your measurement period, if you're going to use a 6-month measurement period, and that measurement period can vary from 3 to 12 months, but if you're using a 6-month, which is how I have most of my clients set up on right now, then we started April 1st. And then we're going to evaluate their variable hour employees from April 1st to September 30th, and then we have a 90-day administrative period to determine which one of those individuals is now full-time, is now part-time, and those full-time people will be enrolled in the plan as of January 1st if they have a calendar year health plan. So to follow on, that's the measurement period, is you'd make that determination whether they're full-time or part-time. The stability period is a subsequent period where you can rely upon somebody being part-time or full-time. So if you've evaluated them, they are now full-time, they have a new measurement period, as does somebody that falls in the part-time period, but they are now stable, and whether their hours, no matter, as long as their job titles or their job responsibilities don't change, they are still validly a variable hour employee. They will maintain that status through their stability period. And at the end of the stability period, which is also their new measurement period, you will make that new determination of where they fall on that line. If somebody was part-time, is now full-time, you'll have to get them enrolled in the plan. Administratively, if you're turning people over every 6 months, that may, on a business side of things, not necessarily be what you want to do. So one thing that I want to stress when you talk about people being in or out on a full-time or part-time basis, just because someone has been established as full-time and enrolled in your plan, and after their second measurement period is now deemed part-time, you don't have to move them from your plan. You can still offer them coverage, but anybody that moves up to full-time, you're required to. So just because you're required to do that doesn't necessarily mean you, or because you're not required to, I should say, you're not necessarily required to pull them off your plan. So our next bubble here is, do you provide health insurance? It might seem a little backwards as we go through it, but there's a method of my madness here. So if you don't offer coverage at all, and you have over 30 full-time employees, and you're a large employer with 50 full-time equivalents, you're going to have a penalty of $2,000 per employee, per full-time employee in excess of 30. So if you have, when you do your FTE, your full-time equivalent worker calculation, and you have 100 full-time equivalents, clearly that's more than 50, you move on to the next calculation, how many full-time employees do you have, and you determine you have 25. Even if you don't offer coverage, you don't have any penalty exposure. If you have 35, then your penalty exposure is $10,000 a year, only for those 5 in excess of 30. The penalty it has been said it will be levied on a monthly basis. So if you look at my math below there, it's $167 roughly per employee per month. And just as an example, if you had 45 full-time employees and you were obligated to offer coverage, your monthly penalty for the month of January would be $2,500. The actual mechanism upon which you will report that information to the IRS, it will be levied upon you. I assume you'd get a bill or you would pay it, has not yet been released. We don't know what that mechanism is. So if you're in that boat, stay tuned for that. Obviously, that'll be rolled out as soon as we get information. So if you do offer coverage, it has to be affordable in order for you to escape penalty. And we already talked about the safe harbors. To meet that, 9.5% of wages are income. The employer plan has to cover greater than 60% of the covered expenses. And Scott talked a little bit about that bronze, silver, platinum, gold. My understanding is, unless you have a self-employed plan or a plan that isn't operating on an offered policy, you're not going to be able to find a plan that doesn't offer 60% of the coverage. But if you do have a self-employed plan or self-insured plan, I'm sorry, then make sure that your plan is up to snuff on that dynamic. And again, household income is that of everybody on the tax return, husband, wife, taxpayer, spouse, and any dependents listed on the return. The penalty for the unaffordable coverage is $3,000 per full-time employee as compared with the $2,000 if you don't offer coverage at all. It's also levied on a monthly basis, and it is limited to the penalty that you would potentially be exposed to if you didn't offer coverage at all. So if you had, my example here, if you have 55 full-time employees, you're obviously obligated to offer coverage to those people, and 20 of those employees have gone out to the exchange and received a tax benefit. The annual penalty on $3,000 for those 20 would be $60,000. However, if you looked at it purely on the amount that would be due, if you didn't offer coverage at all, it would only be $50,000 on an annual basis. Your penalty exposure is the lower amount, the lesser amount. So as an employer, what are your options? Obviously, if you don't offer coverage and under the law you're required to do so, you can offer coverage. If you offer coverage and after you crunch through the numbers, you find that it doesn't meet the affordable guideline, you can contribute a greater amount of money toward that premium for your employees. If you're on the bubble, you could work to lower your workforce to below the 50 full-time equivalent mark. And if you have over 30 full-time employees, you could perhaps work to minimize that dynamic within your business. Absent all of those, you could simply pay the penalty that's due and as a tax and move on. We've already touched on the first other related issue here, and a couple other things that are within the law but have really been administratively suspended. There's a non-discrimination coverage, and Scott mentioned this a little bit on the dynamics within the exchange. This would be a change within those that aren't in the exchange. We had the question of, can we continue to have different classes or different plans for different classes of people within our organization? If you're a company that has 1,000 different employees, you are currently and will continue to be able to offer different plans for management and production in line, to my understanding. If you work within the exchange, that's not the case. Once this Section 105H comes into effect, that will be for everyone. So no matter whether you run the corner deli, you probably wouldn't have 50 employees, but if it's a really successful deli, you would be under that would apply to you as much as it would to, say, Microsoft. You can probably think about what the practical difference is and why this is administratively suspended if Microsoft had to offer the same coverage to every single employee in their company. That's how the law was written. That is not currently in effect because the IRS has suspended it, but it is in the law. The other piece is automatic enrollment. If you do have an obligation to offer coverage, they have talked about, and it's in the law, but it hasn't been worked on at all, is automatically enrolling everybody that comes into your company. They don't necessarily know how it's going to work. The examples that have been given of why it's suspended is if let's say my wife gets hired, but she's on my plan, she wouldn't want to be opted into her new employer because she's on my plan. She's already covered. So what does the new employer, if they have automatic enrollment going on, what mechanism does her employer have to make sure that they don't double cover her? And that's really the practical issue around automatic enrollment that I've read. Not that I've read terribly deep into it. But it is in the law. Generally, the IRS will implement things on a calendar year basis, and generally they'll give you about 6 months notice. So every July 1st, basically, you can kind of count on it's going to be another 18 months before it could potentially go into effect. And that is what I have for you today. Any questions? Or is everybody kind of glazed over?
I know the only number you need to remember is a business owner. That's your accountant's phone number.
It's a very valuable set of numbers to know. If there's no other question, oh, yeah.
Yeah, I just wanted to know, you were talking about all these counts and 1, 2, 3, and how and when do you do that? So am I looking at how many employees I had in 2012 to determine if I have more, what
Very good question. So what she asked was, what period of time are we looking at to find out how many is the 50 full-time equivalent mark is really the one that kind of has its capsule, and that would be on a calendar year basis. So so for 2014, because the first potential requirement you would have is January 1st, 2014. So that's why I said, for anybody that's in that bucket, we need to be evaluating it now. You don't have to have made that call yet, but you have to be evaluating it now to be able to make that call and have your administrative period, which can be no more than 90 days, enroll those people within the plan so that if you have an obligation to cover, then those people are up and going and in the plan January 1st, 2014. Does that answer your question? Okay. Yeah.
Is the affordability percentage, is that based off the individual or the whole family?
It's a very good question. It's based off just the individual plan.
Okay.
So the other piece of that, though, which is where this usually gets confused, is that as an employer, I am obligated to offer coverage to my employee and their dependents, but not their spouse. So I need to structure a plan that offers that coverage to the employee and their kids, but the affordability piece will only be based upon the premium amount for my employee, for just that individual. Yeah, question?
If we issue a 1099 miscellaneous, are they an employee or are they W-2?
Well, whether they're an employee or not is based on facts and circumstances, not necessarily your reporting. What usually happens is that if you have a large number of 1099s, you may undergo an employment audit, whereas an agency would come in and make that determination for you if you've made it incorrectly. That is not, whether you get a W-2 or 1099 is not a controlling factor in whether they're an employee or a contractor. If it's a W-2, that's kind of the highest level. You're not going to have the IRS come in and say, no, this person was a contractor, not an employee. If they get a 1099, they may be an employee, they may be a contractor. That filing doesn't control for that fact.
How do you determine whether they're an employee or not?
It would depend. There's a 20-point test at the federal level. There's a different test, and I think it's a 6-factor test for L&I in Washington State, and I think it's a 10-factor test for the Employment Security Department in Washington State. So it's not easy, is I guess my point of saying that. And it's facts and circumstances. One person that...
As an employer, how would I determine that? How do I figure that out?
Work with your tax professional. That's my best answer. Yeah. Any other questions? Oh, yeah, sorry. Wendy, who is a wonderful asset for us at Larson Gross, and she has developed these handouts. Is your employee a contractor or an employee? And I have plenty of them here. Please take 1 or 2 or as many as you like. That gives you a lot of tools to make that call. But that's really a broad overview. Yeah. Thank you, Wendy. Any other questions? Yeah.
Part-time employees, if our union contract identifies those up to 9 months or part-time employees, they don't get any benefits, does that change under the requirements?
What's their line for part-time or full-time? Is it 30 hours? Is it 40 hours? Is it 35 hours?
A temporary employee could be working 40 hours or they could be working 30.
That's a good question. I haven't been asked that question, and I haven't addressed that. As we mentioned earlier, there are some interesting dynamics having union people on board. My best guess would be you'd have to look at those people in the same dynamic you look at any other part-time employee and evaluate them using your measurement period. If you have a 12-month measurement period and somebody can be a part-time worker classified as part-time, or at least I would assume the point there would be that they're not benefit eligible in getting that classification, not necessarily that they're part-time or variable hour employee.
Right, no, it's just because there's a temporary project or something that they're filling for a period of not more than 9 months.
I see. I would probably suggest that you change your stability or your measurement period to be 9 months, if I'm in that case. That way, I don't have to offer coverage for 3 months before they get on the union plan if they transfer. But that's probably a great example of exactly where you need to sit down and we really need to hammer out the details how that applies to your specific situation. Yeah.
If we do qualify as a small business, because we're under the threshold of the 50 employees, and so we're not required to offer, provide insurance, but you do provide it, does it have to be up to an affordable level and all that?
No.
Okay.
No, if you don't have a requirement to offer it, then the affordability piece is you don't enter that room, so to speak. That's like the third room in the house. But you are eligible for the tax credit. You're potentially eligible for the tax credit, which is a wonderful segue because that's what I wanted to get to before I stop. And Scott mentioned this, and I made some notes on what he didn't necessarily hit, or he wanted to defer to me here. And I have another handout, which also talks about this, for the small business healthcare credit. And come up and grab one of those. But what I wanted to hit was the full-time equivalents, as Scott mentioned, excludes owners. It also excludes people related to the owners. So if I own a company and my son also works in the company, he's going to be excluded from that calculation as well, or my wife, or any what we call lineal descendants. You can, for purposes of establishing the full-time equivalents, for purposes of that credit, establish classes of employee management as opposed to production, as opposed to sales perhaps, and use a different method of calculating full-time equivalents for each class, which can provide some benefit. The FTE for purposes of that is 40 hours a week, as compared with the penalty law is 30 hours a week. And my last point was the 3 methods. So while you're still calculating full-time equivalents under both laws, or both pieces of the law, I should say, there are some differences between those two. So it is its own distinct calculation for full-time equivalents. And I guess the other point I'd make, Scott mentioned 2 years. We can actually go back and amend 3 years. So if you haven't done it for 2010, we could actually be 12 months from now and go back and do that still for 2010.